Hello and welcome. Goa government has extended the statewide curfew till 31st May. Almost 2 weeks into the delayed curfew and we are seeing COVID positive cases decreasing. Although positivity rate and mortality figures are worrying, pressure on the health infrastructure is slowly easing out. So what is the situation on ground and how doctors are dealing with it?
The Bombay High Court at Goa had become the last hope for all those COVID-19 patients and their families who are struggling to get oxygen to save their precious lives as the supplies ran dangerously short due to logistical crisis. After initial ignorance, the state government was forced to pull up its sleeves and get into action, the action that even the judiciary later appreciated. With Goa witnessing unprecedented rise in COVID cases and its related fatalities, the Lawyers Association, NGOs, civil society members were forced to seek High Court's intervention through a series of public interest litigations to bring the situation under control. The High Court too observed that the situation in the state's largest facility, the Goa Medical College, is quite grim and said that the deaths under such conditions were in violation of the fundamental rights of life. While the social media was abuzz exposing the ruthless condition of GMC, which was overburdened with the patients and suffering from lack of oxygen supply, causing deaths every day. The government and the hospital authorities continue to remain on denial mode until the morning of May 11, when the Health Minister Vishwajit Rane himself revealed that 26 COVID patients died in GMC between 2 am to 6 am due to lack of oxygen supply. The Chief Minister Pramod Sawant appeared to differ with Health Minister Vishwajit Rane's contention that the state is bracing under a severe shortage of oxygen to treat COVID-19 patients. 26 people lost their lives in the early hours of May 11. Another 21 died during the intervening night of May 11 and May 12. These deaths were despite HC appeal to the state government to ensure that tonight is testing time and no deaths take place. However, the death spell continued and more 15 people succumbed due to non-availability of oxygen during the wee hours of May 13. The death toll came down to 8 on May 14. The GMC Dean Dr. Shivanand Banekar admitted before the court that the hospital falls short of 700 to 800 oxygen cylinders and around 6.5 metric tons of oxygen. He also admitted that the interruptions in supply of central oxygen on a daily basis is leading to near critical fall in oxygen saturation of patients in the intensive care units. The supply of cylinder oxygen that is used for mild moderate patients has also been deficient and erratic. The government also said that trolleys carrying oxygen cylinders to the hospital were pulled by tractors and brought from at least 15 to 20 kilometers away, and hence increasing the supply was difficult. Not satisfied with the government's contention, the High Court, who had to apologize to the people for failing to control the deaths, was firm that stringent measures have to be in place to ensure smooth flow of oxygen to the patients. After being slammed by the court, the Chief Minister Dr. Pramod Sawant himself took to the field to assess the ground reality. Probably, he even became the first CM to visit a COVID ward and interact with the patients. The state government roped in tractors from Agriculture Department for hassle-free and faster movement. To increase in-house oxygen requirement, the state government installed a 20,000-litre oxygen tank in the premise of GMC, which was made operational on war footing. Also, Dura cylinders with capacity of 28 jumbo cylinders were installed as backups. The state also received over 400 oxygen concentrators from the central government as well under CSR from various private agencies. The CM also managed to convince the centre for additional allocation of 20 metric tons of liquid medical oxygen for the state, thereby raising the overall supply to 46 metric tons for the state. A 3-member inquiry committee was also put in place to probe into the oxygen supply issue at GMC and to recommend improvement in the complete change in the oxygen delivery at the state-run hospital. The state government's war-footing efforts were also appreciated by the High Court, who complimented the state for putting the system in place in record time. The state government has now informed the court that the oxygen supply situation is under control. However, GMC's reputation is at stake due to wrong media reporting, thus causing fear in the minds of patients who are running away from the treatment. Over the last few days, the state's daily COVID positivity rate has shown a declining trend, so also the mortalities. With the second wave coming under control, the state now needs to focus on the possible third wave, which the experts are predicting somewhere in September, October.
On today's show, my first guest is Dr. Vinayak Buaji, who is the president of Goa IMA. Doctor, welcome to the show. And let me begin with that very simple question. Has the situation changed pre-curfew and post-curfew, and how do you analyze the numbers?
Definitely, yes. Talking with multiple colleagues, many colleagues, I am also realizing with the curfew which is put in, definitely the graph has really showed quite a downward trend, except for yesterday where we had a little spike in the death rate. But if you see the data, what has been published, definitely there is a downward trend in the COVID cases.
Doctor, what do you suggest? Now the state government has extended the curfew till 31st May. Fair extension, and how long do you think we need to be in this state of restriction on movement for actually to get this second wave under control?
I would say though we were quite late to get into the curfew mode, but still better late than never. And definitely it has given us results. So coming to the extension date, probably it is going to be difficult because for two reasons. We have to come down to a positivity rate of less than 10%, so that actually we are free of going little bit of we are open to move here and there. And the second important part of continuing with the extension of the curfew totally depends on the social responsibility of the public. As long as public do not take note of this serious disease and they don't accept about what is COVID-19 and they do not get scared of the disease for the sake of their own people or their own self, it is a bit difficult to draw a line till how long. It is self. Now the days of advising others are gone. I have to ask and I have to advise myself when I want to move out, whether it is really necessary to move out, whether what is the genuine reason I have to move out, and if at all I have to move out, what precautions or what we call the COVID protocol behavior, it has to be followed very, very strictly. If we don't cooperate with this, it is nothing going to be attained with COVID.
I am joined by Goa Resident Association Doctors President Pratik Sawant also. Pratik, if you can tell us, because you are the people who are working on ground in Goa Medical College and you are practically flooded with patients for last almost more than a month. How is the situation pre-curfew and post-curfew? What have you noticed when it comes to the situation on ground?
Post curfew, definitely the situation has improved. In the past 2 weeks, we have seen a constant plateau or somewhere a downtrend in the number of cases. To compare the figures, pre-curfew we had around 1,000 to 1,200. And see, yesterday the figures are around 760. Compared to the early stages of the pandemic, like on 12th May, where we had 75 deaths, day before yesterday we came down to around 31, and yesterday there were around 45 deaths. So definitely conditions are improving, but a lot of measures have gone into bringing this into a plateau or somewhere a downtrend. To name a few, it is not just restrictions or curfew imposed by the government. It is also the people who are now more aware and they have self-imposed restrictions upon themselves. Then it is also because where the healthcare facility has expanded itself into a form of a super specialty block, more number of beds. Now the oxygen issue has also got a short-term solution. So all these things have helped us in decreasing the mortality, or what do we say, the number of admissions. Yesterday we had around 60 to 70 admissions as compared to 1 week back where we had almost had 130 to 140 admissions. So these figures are improving, but we are not there yet. It will take us almost a week or more, according to me, to have the situation under control. And that is very important to plan if at all a third wave hits us.
Dr. Buaji, when you look at these numbers, You said that we are a bit late in imposing curfew. How late do you think we were? Means because our last in the first wave, our peak was something like 1,100 cases, and this time we went close to 3,500. So, how late do you think we were in enforcing curfew, and would mortality rate been different if we were gone into a curfew state probably a month or a month and a half back?
Definitely, it is very obvious after the first wave, we Goan people, along with the full infrastructure, we were quite complacent in the thinking now we are free. So that added, and definitely whatever said, in spite of the suggestions by all the NGOs, all the associations, all the public, definitely there was a delay in putting up the curfew. If this curfew had to be put little earlier, forgetting all the factors, how it would affect and all, but definitely the incidents would have been, I would say, lesser than this. We would not have been seeing so many mortality rates, okay, so many complications, so much of a strain on the health sector, and along with that health sector with everybody. Definitely, it has made a difference. It actually has given us the impact of giving us bad figures in the terms of death.
Uh, Dr. Pratik, you guys faced a huge resource crunch when we started peaking. Has that situation eased out now? Because everybody was appreciating the way all of you are working in the GMC, trying to save lives in spite of limited resources. Post that, there was a High Court intervention, media intervention, civil society intervention. Do you think things have improved?
Yeah, first of all, big thanks goes to all the Goans, all the media people, the High Court directive, the government, the authority for actually taking into account what a doctor at the ground level or the grassroots level is suffering. At the beginning of the pandemic, we had just before the start of the second wave, we had just some 8 dedicated wards to COVID, and South Goa, apart from South Goa District Hospital, which had around 450 to 500 beds. Today, we have jumped up to almost 30 COVID wards in GMC itself, apart from super specialty block and 4 dedicated COVID ICUs in super specialty, apart from strengthening up of resources in South Goa District Hospital. So what that has done is now the patients are, there has been a gradual decongestion of patients in GMC. So everyone is getting probably the new admissions which are there, most of them are getting beds at admission. The short-term solution in oxygen was one of the best things that happened for in terms of healthcare, because it was the need of the hour, and with this short-term solution in oxygen, it eased out the pressure on doctors who are working. But we really need to look at long-term solutions now, because all this was done in keeping in mind that the pandemic had peaked. But once it starts regressing, it will be very important for all of us to realize that the war is still not over.
Yeah,
It
you're
is
very
just
right.
a
We
beginning.
cannot be forever in a firefighting mode. We need to take care that there are no new fires. So I think that's very important. We just being prepared for firefighting is not enough. We need to ensure that there are no new fires which we will have to battle in the coming days. But Dr. Pratik, before I go back to Dr. Buaji, just to give everybody across the country a sense of what a doctor in GMC went through during that resource crunch and after that intervention. Please tell us, how were those days? How were those nights?
Yes, those some of the most of these nightmares began to all of us doctors in the last week of March and the first week of April. So this was the time when GMC had slowly started were conducting both COVID as well as non-COVID work. So all the departments had their routine services as well as COVID. So by end of April, by end of March, what we noticed was there was a sudden surge of cases. We had around 8 to 10 dedicated wards for COVID. We had less resources. Not all routine services were stopped. So there were around one doctor per 30 patients. There were issues of oxygen. There were issues of shifting, there was delay in getting the cylinders, and that took a heavy toll on the mental and the physical stress of the doctors. Physically, all doctors, even today, are working around 12-hour shifts, and it was very difficult for all of them to cater to the needs of all the patients together. With the oxygen issue bubbling up, there were patients who were desaturating sometimes around 4 at a time in the ward, and a single doctor who is in the ward was not
Yeah.
able to attend to them immediately.
Yeah.
That lead to aggression. That lead to a kind of hostility towards the public, towards the doctors, because they felt that they were not tended to immediately, which is quite understandable given that when someone's very own person is suffering, you have to take active intervention. And that's what Goa did. Today, Goa has helped us. Today, Goa is in with support with us. And today, we have improved our resources and the strength. But those days, to tell you, were a real nightmare.
Dr. Pratik, please don't thank us because the kind of work you have been doing for us, 12-hour shifts every day, relentlessly, I think we cannot thank you enough because we did probably what was required to save our loved ones, that those interventions were required from every sector of the society to save our loved ones. But the way the doctors in the GMC have worked over last couple of months, hats off to you guys. Dr. Buaji, very frankly, before we go to the third wave question, what is the major difference medical fraternity experiencing between the first wave and the second wave? May it be a rate of infection or the rate of mortality or the positivity rate, which is still about 30% in Goa. So what are the major differences? You have treated patients, your colleagues have treated patients. What's the biggest difference?
Before I answer that question, since we are short of time,
Yeah.
I really compliment Pratik, Dr.
Yeah.
Pratik and his team, because as rightly you said, I really endorse it. The guard, the team members and the doctors from medical college, actually they make a backbone of our Goa health sector.
Yeah.
And then the other hospitals like SGTS, Margam IT, and then some of the private lobbyists as well. Anyway, saying that the difference of management from the first wave and second wave in the private sector or the government sector, it is more or less totally on a larger scale. See, initially in the first wave, what happened? We did not know the basically the pathophysiology or the total. We did not know the disease at all. So after certain time, the virus definitely wanted to change, and the virus changed to a actually worse thing, and it did hit us very badly. So definitely by that time, after some research work, we had already realized that how the virus is going to attack our body. So we were not 100%, but we were definitely 70 to 80%
We're
prepared.
getting better understanding.
Exactly. Now here, what happened? Like because of the shortage of resources, we had tough time. It was in medical college in the government sector as well as private sector, because as well also we never had medicines or the resources in hand to tackle. And definitely we had little bit of a shortcomings in our private sector. That's because of the resources. But in this situation, the positive rate and the virulence of the virus, positive rate really went up because the total aggressive virulent stage of the virus. And it was not like that initially what we thought, like okay, once we get the infection we will start getting the symptoms after 15 days or 17 days. That time the quarantine period was kept as a 17 days. But here we realized the behavior of the virus was so absurd. The moment you get the infection, suddenly you could get into a very severe degree of infection. And we have seen cases we have lost lives of near and dear ones. That's a major difference. Again, in input of our getting more medicines and getting more resources to tackle this virus was on a very very big scale we had to put in, which was unlike the first wave. So definitely there was a big difference in everything, in all the angles of managing COVID, right from the management at the with the oxygen or the medicines, with the manpower. We have to enforce more
Yes.
power. We have to get in more better
Yeah, Dr.
infrastructure.
Pratik, same question because you guys handle thousands of patients during first wave and then we are into the second wave. What are the salient features of the second wave, which are different from the first wave?
Basically, a few precise points would be what is very obvious to everyone in Goa was the second wave hit us much harder than the first wave. Today, we didn't have many critical cases as such in the first wave. We were able to manage with the resources we had. This time, it wasn't the case. This time, our healthcare was burdened. We had around 200 to 300 admissions coming in. Then the duration of stay was longer. Earlier, most of the patients had mild disease with fever coming up for 3 or 4 days. This time it was almost average stay was almost around 7 to 8 days. Many patients required critical ventilatory support, which was not the case in the first wave. This time, there were even if you compare the symptoms, the first wave had quite most of the patients presented with cough, breathlessness. Now there was a variety of symptoms. Patient had gastrointestinal symptoms. Some of them presented with the typical respiratory complaints. Some of them presented in a very late stage with acute with ARDS. So these were basically the differences that we handled this time. Apart from the logistics that we all know of, there were a lot of stress on all the resources, be it medicines, be it oxygen, be it manpower, be it beds or hospitals.
Dr. Buaji, final question about the third wave. And when we speak about children getting hit, I think it worries everybody. So the government has formed a task force now. What do you expect the government to do on war footing, short term and long term?
Definitely, third wave is definitely, see, this virus is going to remain with us for quite a number of years, or maybe it will remain throughout, and future it will be a separate topic for medical students to learn as such. So keeping this in mind, third wave definitely sooner or later may hit us. Now we don't know when and how. Now coming to the children getting affected, so probably there are lots of reasoning, because see, most of the adults now are getting covered by vaccines. Okay, it has started from 18 to 45. So still there's a big bunch of big percentage of Indian population who are not vaccinated, and the children less than 18 years, they fall in there. Secondly, once the wave comes out, now everybody is bored sitting in the house. They do not have any access to open. So there are chances the children or the college students or the school students or the primary students, they might be open for their institutions, and they will start intermingling with each other. Suddenly, there might be a surge in the COVID in the pediatrics or the below 18 age group. So definitely, with the newer task force or the newer ideas from the government, we have to think about this factor in case, because right now we know that all the medicines which are being used anti-COVID are basically for adult.
Yeah.
So we do not have anything specific for pediatric age group, because many medicines cannot be used in the small age group. But God forbid, like if something happens like that, we do not have a ultimate weapon in our hand, like
We do not
giving
have a
antibiotics.
protocol in our hand.
Exactly,
Yeah,
exactly.
yeah.
So better the treatment would be just prevention and keep them away from this infection.
Uh, Dr. Sawant, what do you expect? Because again, if there is a third wave, God forbid, so vulnerable section like children are affected, again, it's going to be Goa Medical College, because we all primarily depend upon Goa Medical College and South Goa District Hospital, North Goa District Hospital, and additional facilities like ESI Hospital. What do you expect from the government at this point of time, so that, okay, we are prepared for firefighting, but we also ensure that there are not much fires lit after this third wave?
Yeah, so I would like to put up a few very brief points. First is we need to plateau the current peak. Unless we plateau this peak and get some kind of normalcy, I don't think it will be possible for anyone to think of a very long-term plan. Second point I would like to say is better anticipation. All of us knew when the government and when the institution had anticipated, even with a cyclonic wind for 2 days, we were quite well off as compared to before. So a better anticipation from all quarters can go a long way, even in a very emergency kind of situation. Third is vaccination. Unless we ramp up our vaccination and somehow give rise to herd immunity, we will never be there. We will, by increasing hospitals, we can never control the amount of accidents that happen. The
Correct.
only way that we can control is by having better road safety
Yeah,
rules.
ensure that there are no fire outbreaks.
Yeah. So
Yeah.
to control vaccination, we will need to control the epidemic. We will need better vaccination. Apart from having better healthcare facilities. Fourth point, we will have to ramp up, have a protocol for pediatric ICUs. We will need a lot of more of pediatric wards, pediatric beds, their medicines, and a lot more doctors and nurses and attendants. Once we get through this second wave, the first thing that we'll have to look forward is to have more doctors, more nurses, and more attendants, and to have a bigger pool so that even if some of us get affected and are positive, we still have a pool to work with, and we are never short of healthcare workers.
I think very, very important points. So Pratik, Dr. Buaji, thanks a lot for joining. I think the most important point for third wave is, as Dr. Buaji rightly said and Pratik also pointed out, we need to have a protocol, treatment protocol and preventive protocol, both in place, publicized, mass awareness, so that we are prepared for a third wave and we ensure that our children are safe. I think that is going to be the biggest task before this new task force. Dr. Buaji, Pratik, thanks a lot for joining. Keep watching. Go ahead.